Well, as President Biden issues a sweeping new vaccine mandate for millions of Americans, health officials are urging the country to stay vigilant. Dr. Anthony Fauci says that we will continue to be in the, quote, full pandemic mode until COVID cases dip to 10,000 a day. According to the CDC, the 7-day moving average of COVID-19 cases in the U.S. is currently more than 136,000. Infectious disease specialist Dr. Ogachika Alozi joins us now. He's the medical director for Sunset ID Care in El Paso, Texas. Thank you so much for joining us. Yesterday, President Biden announced his 6-point COVID strategy. And with only 53% of the U.S. fully vaccinated, some critics argue that the federal government should be stricter with vaccine mandates. What's your take on this?
Think that the president has taken a much needed step. It's unfortunate that in this country, at only 53 to 54%, we have such a long way to go after announcing independence from COVID. I think the federal government has to drive on this. Obviously, there are states that will never do this. It's going to be tied up in a lot of legal challenges. But it's also interesting to me that the people that are pushing back the hardest are politicians. People that have never seen a COVID patient, people that have never been involved in this pandemic to save lives. The medical community is on board with this. I think it's important, particularly for healthcare facilities, to get on board with this. And I think it provides that impetus and sort of guidance for private sector people that want to mandate it for their employees.
So speaking of people who have never had to deal with patients, you are on the front lines. I've actually, we've done some stories out of Texas, and it's heart-wrenching. Yeah. Can you describe what you're seeing and facing when it comes to treating COVID patients?
I will say this. I am lucky, blessed, sometimes better to be lucky than good in the fact that I live in El Paso. We have the highest vaccination rate for COVID-19 in the state of Texas. And so we're a little bit different. And talking to my colleagues in Houston, San Antonio, Austin, they are up against it. I also think it's sort of interesting that as the numbers are coming down, right, this is when this announcement comes out. But remember, numbers coming down, we still have 2 to 4 weeks of people getting sick, being in the hospital, and unfortunately and potentially dying. So the hospitals are up against it. There's a nursing shortage across Texas and across the country. We're using more contract nurses than we've ever used in the history of healthcare. And it's not just in Texas, it's across the South. And so this is really where that concern is. I think it's important that numbers are coming down. Hopefully people are heeding the mask, get vaccinated message, but we still have a long ways to go.
So the conditions that you're describing, and you say you're lucky, I'm sure you guys went through it at the beginning of this pandemic. The conditions that you're describing, how does that impact patient care? Not just those who are coming in with COVID, but all the other patients who are coming in need. Are healthcare providers finding themselves having to ration their services because they're overwhelmed?
Yeah, I think that we have been, again, the conversation about rationing of services is not there in most communities. I think what you are seeing, though, is that continued delay of services. Somebody that has a broken hip, somebody that has maybe a heart problem that should have gone in, can't go in because the hospitals are either full or there are not enough doctors or nurses to actually give them the proper care that they need. And this is the unintended consequence of a community that's just not vaccinated. In communities that are vaccinated 70, 80 and above percent, not only does it protect the hospitals, but also protects the children, right? That data is pretty clear. The more adults you have vaccinated, the less children that are infected. And so, again, it's really unfortunate that we're here. I think if we talk about a layered approach, vaccines and that Swiss cheese model are the biggest piece of cheese. And that's the piece of cheese I think the president is pushing for people to chew on.
I want to ask you about an interesting case out of Texas. A man there recently died of COVID complications during a legal battle to get him ivermectin after nothing else worked. A judge ordered the hospital to give him this treatment, and doctors refused. So just to remind everybody, ivermectin is an anti-parasitic drug that's become sort of popular online. It is not a drug that is supposed to be used to treat COVID at all. In fact, though, it's so popular that some people have been trying to acquire the dosage that is usually available for livestock. So, it's a little crazy out there. But can you help me understand? Why a doctor would refuse to prescribe a patient a drug if this person is saying, I'm sick, nothing is working, let me just roll the dice on this other drug that I read about on the internet. Why not just allow them to have it?
I mean, I hear that argument a lot. I've been involved in some of these cases myself over the last 2 weeks, especially. And I think at the end of the day, right, our oath is to do no harm. And in some cases, you could say, well, what is the harm in a dying patient getting that ivermectin? Perhaps. But I think in healthcare, we don't just do things to do things. We don't just give people mercurial salts or Epsom salt because we believe it works. There has to be data. And to date, the data we have is around dexamethasone primarily, remdesivir, Actemra. And I think there are multiple randomized controlled trials that are coming out for ivermectin. Let's see what they show. To date, there is no scientific evidence to show that ivermectin works. And it's unfortunate to me that a patient that doesn't want to get vaccinated would prefer ivermectin over the therapies that we give in the hospital. And so I think that it's unfortunate. It's an unfortunate story. We hear it hundreds of times a day or week potentially across the country. But I think the key here, again, is that if you don't want to be in a conversation about ivermectin, the conversation really has to be, why aren't you getting vaccinated now with the most dangerous variant that we have to date?
You read my mind, doctor. I was thinking, you know what the science says? The vaccine works. So why don't you start there? So let me ask you about something else. Speaking of the vaccine, Moderna has announced that it's developing a 2-in-1 vaccine booster shot that protects against both COVID-19 and the flu, which is kind of interesting because a booster shot, if it comes out, it probably will come out around flu season when people would also be getting their flu vaccine. I've never heard of a 2-in-1 vaccine. Does that exist? And does it have the potential to ease hesitancy, do you think, around the COVID vaccine if people are already comfortable with the idea of taking a flu vaccine?
Yeah, so I'll answer the second question first. I'm not sure whether that hesitancy will change. I believe that our hesitancy around vaccines in this country is tribal. It's not data-based or evidence-based. I think for ease of distribution, it's a great idea. We already have multiple vaccines, whether it's measles, mumps, and rubella, or the Tdap, which is the tetanus, diphtheria, pertussis, right? And so we have vaccines that have multiple things in them already. I think this is a good idea for those that will get it. The problem we have in the United States is that we just don't have enough people that are getting it. And I think we're probably going to end up with 20 to 30% of our population that refuse vaccination. It's going to put us in a really tight position. I think it's also important to have this conversation about where we go next. And I know the arguments will be, well, Dr. Fauci said 10,000 cases a day. Some say 50,000 cases a day. I think just like buying a house, it's location, location, location. El Paso is not Miami. New York is not Baton Rouge. And so we're going to have to be able to tailor that so that local health departments can make those decisions. And in some parts of this country, they're living as if COVID is a past. It's going to be an endemic virus, and we have to learn how to live with it like the flu. I think that's why this booster is important.
I think that is such a good point that you made about location, and it seems to be something we have not been able to absorb for the entire time we've been battling this pandemic. That yes, you need sort of widespread regulations, guidelines, but also it's different in different locations. So just because you're not seeing an outbreak doesn't mean you're not at risk, that it might not be coming your way. So you do things to make sure that you can protect yourself. For the longest time, everyone's been kind of thinking that whatever they're experiencing in their bubble is all that matters. Dr. Ogachika Alozie, thank you so much.
Thank you so much. I appreciate it.